So today we will begin with the building of the pelvic floor because it is the foundation of everything. I will not list all the muscles, groups, and ligaments of the pelvic floor, nor will I name them in Latin because that is not the most important to know. Instead, I will show you visually how the pelvic floor looks and explain why it is so critically important. I am Dr. Olena Berezovska and I welcome you to my YouTube channel. The pelvic floor bones together with the spine form a bony ball that resembles a funnel. Its narrow part is the opening through which children are born. The diameter of this opening is approximately 11 centimeters. This area is called the pelvic outlet. If we look at the structure of the human body as a whole, what do we notice? At the top, there is a diaphragm, a strong muscular ligamentous structure that separates the thoracic cavity from abdominal cavity, where the internal organs are located. At first glance, this part of the body may seem relatively unprotected. However, the rib cage formed by the ribs and spine posteriorly provides a protective framework for the heart and lungs. These are vital organs, and damage to them dramatically reduces a person's chance to survive. At the same time, the internal organs of the abdomen are located within the abdominal cavity. They are supported and protected by a specific belt, a layer of muscles and ligaments that form a cylindrical supporting framework holding the internal organs in place. This refers to the muscular ligamentous structure of the anterior and lateral abdominal walls. When this structure weakens, various problems can arise, including anterior abdominal wall hernia. Importantly, this system provides a fairly effective form of protection. In situations of danger, the human body instinctively assumes the fetal position. You may have noticed that people curl up when they feel unwell or threatened, drawing their knees to the chest. This is the fetal position, a natural attempt to protect the internal organs from potential injury. Everything located within the pelvic bone is referred as a small pelvis. It serves as a primary support structure for internal organs, especially when a person is not in horizontal position but in a vertical one. When a person stands, walks, or moves, all the structures must be balanced and supported by the pelvic floor. The small pelvis contains critically important organs, part of the intestine, the urinary bladder, internal reproductive organs, lymphatic and blood vessels, nerve endings, muscles, ligaments, and other structural elements. In other words, the small pelvis is densely filled with vital structures. Now imagine what happens if the small pelvis, more precisely the pelvic floor, begins to sag. This leads to the descent or prolapse of certain organs, which can cause symptoms like pelvic pressure, urinary incontinence, and discomfort. We will discuss these clinical manifestations in detail later. Most often, pelvic floor dysfunction, including organ prolapse and muscular changes, becomes apparent in a vertical position when a person is standing or walking. In the horizontal position, pelvic floor dysfunction is usually not evident. This is an essential concept to understand. To prevent these organs from descending or protruding through the pelvic outlet, especially in the upright position, the pelvic outlet is covered by a complex group of muscles and ligaments known collectively as the pelvic floor. The pelvic floor has an extremely complex structure even when viewed schematically. If you look at the anatomical illustration, you will see that the pelvic floor is almost completely lined with muscles and ligaments. In essence, it forms a supportive ball. This network of muscles, ligaments, and other critical components is designed primarily to counteract gravitational forces when the body is upright. inertial forces during movement, and intra-abdominal pressure which naturally exist with the abdominal cavity. All of these factors are essential in maintaining proper support of the pelvic organs. If even a minor failure occurs in this foundational system, comparable to a crack in a building's foundation, pelvic floor disorders may develop. That's why in medicine we speak of pelvic floor disorders rather than so-called intimate muscles or similar non-medical terms. Pelvic floor disorders are a collective term encompassing a wide range of dysfunctions involving the organs of the small pelvis as well as the muscles and ligaments of the pelvic floor. And the correct medical term is pelvic floor. Approximately 30% of women will experience pelvic floor dysfunction at some point of their life. That means nearly 1 in 3 women will face these issues. Moreover, about 13% of women with pelvic floor disorders will eventually require surgical intervention. As mentioned earlier, pelvic floor function is most evident in the upright position during standing, walking, or physical activity. In contrast, when a person is lying down, resting, or sleeping, pelvic floor dysfunction is generally not apparent. This is a critically important point. This is a key principle you must remember. To effectively strengthen the pelvic floor muscles, start exercise in relaxed position, such as lying on your back or on your abdomen, especially during the early stages when gravitational pressure is minimal. This approach encourages confidence in safe practice. This is a key principle that you must remember. When we talk about pelvic floor disorders and pelvic floor dysfunction, management should involve multiple medical specialists, not only gynecologists. A gynecologist alone cannot address these issues comprehensively. When you consider the complexity and size of the structure between the legs and within the body, it becomes clear that urologists, proctologists, traumatologists, and other specialists must also be involved in assessment and treatment. In other words, a multidisciplinary approach is essential for proper evaluation and for making informed decisions about what and how to treat. We will continue our conversation next time and discuss other important topics. Subscribe to my channel.